Hi, this is Dr. Bob Dannenhofer. This is another one of our Facebook Live events. You can find those on our Facebook page at the Douglas Public Health Network or DPHN. So we've done a couple of these and we're back again tonight. I think certainly anybody who's been paying attention realizes there's increasing worry about the spread of the coronavirus or COVID-19 over the last week. You know, we've had an incredible increase in number of cases. The number of cases outside of China has almost doubled in the last week. So, you know, we're really at a time when we're really at a worrisome time. So we're here tonight to answer your questions. If you have questions, go onto our Facebook Live and write them in the comments. Kristen and Vanessa are here today and they're going to do those. I imagine we may get more questions than we have time for, but we'll start from the top and move down. So the first question is, where are the test results from last week? Are you hiding them? When will they be posted? So the answer is we're not hiding them. We don't have them yet. I was working all weekend and I think I checked every hour to see when they were ready, and they're still not ready and still not ready. We talked with the company this morning. Again, these are being done down in California. When they started doing them last week and they were available, lots of people had the same kind of idea that we did. So throughout the western part of the country, there were lots of people who did these tests and sent them there. And so while we were promised a 2 to 4 day turnaround, it's more like a 5 to 7 day turnaround. We were kind of promised that we'll see the results tomorrow, and when we get them, we will post them, but we don't have them yet. These tests are important. We did 52 last week. We're going to do another 45 tomorrow, and this will really get us a good idea whether the disease is present in Southern Oregon. If it is, how widespread it is. You know, it's been sort of a quiet couple of weeks. You know, we had our first case about 3 weeks ago. Nothing since. We've sent over 50 tests to the state on really high-risk patients. That is, people get admitted to the hospital with pneumonia. Every one of those is negative. So it's a little quiet now, but it's not quiet in the rest of the state. Lots of cases up north. I think there were 30 cases this afternoon up in the Portland area, and certainly not quiet in the rest of the country, where we had about 9,000 additional cases through the country. So right now, a little quiet here locally. We're still waiting on the results, and we're not hiding them. We would not hide anything from people. Is there still only one case in Douglas County? There is still just one case in Douglas County, but again, we'll be up all night checking to see if those news results are in. So one of the things that happened in this last couple of days was there's been a real interest in these homemade masks. I was going to bring one to show you how neat they look, but they really are kind of great. And those homemade masks, there's a group called the Umpqua Sewing Warriors. And they're working out through Oregon Serigraphics, and they have put together kits so that people can make these at home, and the hope is that we can get them into the community. Now, these masks are probably not going to be appropriate for healthcare workers, but they certainly would be appropriate for patients who were either sick or for some reason wanted to wear a mask. The good news is that once they get them to you, they're yours, so you can have them. And because they're made of durable cotton, they should last a long, long time. So we're hoping that these get out. They have the first batch will be ready now, and we're going to deliver them mostly to clinics and hospitals and EMS and groups like that who may want to give these masks to people who are coughing in their area. So if you want to do that, if you know how to sew, please go and check out with Oregon Serigraphics. So the story is, can the virus be on fruits and vegetables? And Crystal asked this question. Maybe, you know, these viruses live in wet conditions, but fruits and vegetables could. But I think if you wash the fruits and vegetables, I would have no trouble recommending the continued intake of fruits and vegetables. And say, can we breathe it in without knowing when in public? The answer on that is probably yes, although only if somebody else has it. So there have been a couple of stories in the last week, well documented in New York and Connecticut, where one person at a party could infect many people even before they were terribly symptomatic. So you probably can get it. So again, our best advice is social distancing. So social distancing means if you can touch somebody in your sphere, you're too close. So social distance. By the time you social distance, almost all the particles will have dropped and you won't get it. So the question Ashley asks, what can we do to help our mental health right now? Being stuck outside, inside, and isolated can really take a toll on the mental health. That is so important, right? During this time, there's a lot to worry about. but there's some things you can do to stay healthy, and I think the governor talked about those today. You do not need to stay inside. So yesterday, I had a little break in my activity. It was a beautiful day, and I took a walk. And when I walked, there were a couple other people there. When I saw people approaching, I moved to the street so they could pass within 6 feet, and then I kept going. It was such a gorgeous day, and I would encourage everybody to get outside. So actually, the government encourages activity as long as you can do proper social distancing. And yesterday, I could take this walk and properly social distance. Bike riding with proper social distancing is great. What we'd avoid is outside activities where you might expose other people. So a yoga class or something else where it would be really hard to get the proper social distancing, where we're doing that. There are other things you can do for your mental health. Be really nice to yourself. I know this would be a time you might be able to get extra sleep. This is a time you may be able to do some joyful activities like reading a book or watching a movie that you really like. Anger feeds on itself, so I know there's a lot to be angry about in the world here, but let's try and give that down. The other thing that you can do is you can still communicate with people. Actually, this for me has been a time when I've called friends and relatives a little bit more than I typically would to hear their voice on the phone and to see how they're doing. So those are all things you can do to improve your mental health. So are you able to speak to what symptoms are a deciding factor for a primary care provider to refer someone for COVID-19 testing? And Jessica asked this question, and the answer is I can. So the story is that that the people who are the highest yield for having a positive test are people who have cough and fever for at least 2 days and less than 14 days. So we know that people who are most likely to shed this virus, most likely to have a positive test on the 3rd through 13th day. After 13 or 14 days, your body sheds much less virus, and the test is not very good. And in the first few days, there's so many other things that could cause cough and fever, upper respiratory infection, and others. But most upper respiratory infections, the fever is gone within 48 hours. So if you're still having fever after 48 hours, those would be the reason to get the test. We have 45 people signed up for our clinic tomorrow, so we're not going to be able to sign up any more tonight because 45 is our limit. But we're holding those to do on Friday if we get. So the question is, can asthma inhalers help with the symptoms, Dawn asks. So the story is that only people who have asthma does it help. The Chinese have not found that inhalers helped that much. So either inhaled corticosteroids or inhaled steroids or inhaled beta-adrenergics. The good news is it won't hurt. So if you have a history of asthma and you have an inhaler, you're feeling a little tight, go ahead and use it and see if it helps. If it doesn't help, you may want to call your provider, but there's certainly no harm in trying it. So somebody says, Brooklyn says, is COVID-19 something we can become immune to once we've been exposed? This is something we are not sure about. We think so, but we're not sure about. Now, some viruses, when you get them once, you never get them again. So measles, I had back in 1961 or 62, and now 50 years later, I'm still quite immune to the measles. Other things we don't develop nearly as good immunity to. So that nasty cruise ship bug, the norovirus, you only get immunity for a few months, and that's why you can get norovirus again and again. This one we don't know. Now with the other coronaviruses, you do seem to only get them once, so we're hoping that. The way we'll know for sure is we'll do these things called antibody tests, and once we get the antibody tests, we'll be able to tell whether you have lifelong immunity. So Doug asks, is there any updates on the use of ibuprofen? Yes. So that was one report that ibuprofen might make it worse. Subsequently, people who treated other people said it doesn't seem to be the case. So that's the update. I still don't know the answer, but the general recommendation now is to disregard those negative things about ibuprofen. Again, I want to point out the Oregon Serographics. They're the group with that are doing this, these homemade masks. My wife made a few. They are really adorable. For Facebook, they're on the Umpqua Sewing Warriors. And if you want to call Oregon Serographics at 541-672-6296. That's 541-672-6296. So how many have been tested total and how many are positive? So for people who've been listening before, I've said this again, there are two kinds of tests. One is the CDC test, which is done at the CDC in the state. When I heard today I think the number was 57 that had been tested. 1 was positive and 56 were negative. And then there are the tests that are done through the commercial labs. We did 52 of those. They're all still pending. There are a couple other people in the community who have done a few through LabCorp. Those are all negative. So when we get these results from last week back, we'll have tested over 100. Now, the percent positivity rate is a key factor to know how much it's spreading. So if when you do these tests, more than 10% are positive, it means the disease is widespread in your community. If when you do it, it's 1% or less, it means the disease is not yet widespread. Between 1 and 10% means it's getting there. So this is why we're doing it, to figure out what the numbers are. People have asked me to predict how many would be positive, and I said, if I could predict that, I wouldn't need to do the test, and we do. So is DPHN the only testing available in Douglas County, and how long to get the results back, Lacey asks. So any person in town can do the testing. However, to do the testing, if you saw the stuff in the newspaper or saw the stuff on TV, you really want to protect the person. So I've done hundreds of these tests, and what I tell people, if when you do the test you don't gag and cough a little bit, you probably haven't done it right, because you have to stick this thing 5 inches into your nose, let it sit there for a while, twirl it, which usually causes the cough reflex, let it sit for another few seconds, and then pull it out. So these people are really coughing and gagging on you, so we want people to be fully protected. At the same time, we're really wanting people to preserve masks. And so that if I did this for a kid in the clinic and I wore a mask, I would have to just get rid of that mask and throw it out, which means that mask will never be used. So anybody in the community can do it, but we're really trying to do these in a place where we can really protect the providers and not waste our PPE. So had a clinic up north asked me to do this, and they said they only had 16 sets of PPE left, and should they continue testing? And the answer is, well, no, because if you test 16 more times, you'll have no PPE left. And then when you have a patient who's really sick, you'll have no way to protect yourself. So it's a balance between wanting to know the results and a balance between not wasting all your PPE. And the answer is how long to get the results back. So when we started this, they said 2 to 4 days. We waited, knowing, counting, I could tell that this weekend was more than 2 to 4 days, and it didn't come through. When we checked again this morning, there's none there. And so we said, well, now it's 5 to 7 days. So 7 days will be tomorrow. We certainly hope to get some results then. So should we continue appointments at our doctor's office for preventive care? Mike asked this question. And the answer is you should talk to your doctor. Now, I would say there's some preventive care which is that important that you probably should arrange to actually have a face-to-face visit. So, for example, I'm a pediatrician, and the most important visit we do is at 2 weeks. So here babies are just born. They usually lose weight in the first week, gain weight in the second week. So by 2 weeks, they should be back to birth weight. So many things can go wrong with that. And so skipping that preventive visit, I think, would be a problem, because parents are really not good at judging how their baby is doing. And sometimes I've seen parents who come and think, oh, the baby's great, and they're not. And so, for example, that visit I would do. But like an 11-year-old well child check, I certainly would not do that in person. Now, there are many clinics, including Aviva, that's going to start to do these clinics virtually. So what is these visits virtually? So what does that mean? Well, when I do an 11-year-old visit, some of it is doing the height and the weight and the blood pressure and those things, but a lot of it is talking about preventive stuff, like you should be worried about smoking and you should be wearing your seatbelt and sunscreen and whatever. You can do that perfectly well on telehealth, where screening for depression could be perfectly well done by telehealth, and you can screen for other kinds of risky behaviors that kids may be doing at that age, all which can be done by telehealth. So at least at Aviva, my well child visit tomorrow morning are going to be done all telephonically. So the deal is, are there any regulations for grocery stores? Yes, grocery stores are open, but we're really, really asking people to socially distance. So I went to the grocery store yesterday, and I was very clear at the grocery store that I stayed 6 feet away from people. So there was somebody else looking at the tomato paste when I wanted to look at tomato paste. So I waited until they were done. I let them move away, and then I looked at the tomato paste. So you can certainly do that. So try and be 6 feet apart. When I put my groceries down and they were bagging them in whatever, I stood back, maintaining my 6 feet distance. So grocery stores can stay open. There are no specific regulations other than we should try to prevent we should try to prevent social or promote social distancing. So Emily asks, who can we call to see if our business should stay open? I think the governor's order is quite clear. So I would look specifically at the text of the governor's order, which was posted today, about which businesses should stay open. So basically, businesses should close if you're not doing essential things and you can't avoid distancing. So things like nail salons where you can't avoid distancing, or hairdressers. Restaurants are asked to stay closed except for takeout or delivery. So go through that. I think the order is pretty clear. I think if you have questions, you could certainly give the hotline a call and see what they know. So Lisa asks, if we're supposed to be staying at home, why are they saying we can still go grocery shopping? Well, the answer is we don't want people to starve. And so you should stay home. And so if you had enough food at home, you should stay at home. We did need some groceries yesterday, and we got those. So you can do that, but I would try and do it safely. So again, I wouldn't stand in line. I wouldn't stand right next to somebody in line. There was this lady behind me in line who wanted to get right up next to me, and that would be worrisome. Jessica asks, are people with asthma in a high-risk category? Very interesting. In China, they did not necessarily note asthma as a high-risk condition. Now, I don't know about that. I mean, the Chinese data, it was all lumped together. It was done quickly. So I don't know that. So the story is, can we visit national parks that are still open? It's up to the national park. And again, being outdoor activities are really good for you. I don't want everybody to get cabin fever. I want people to get a little sunshine. I want people to get exercise. A couple of issues with national parks. One is, if you're going to think you want to eat at the national park, that's going to be an issue because, again, we're trying to avoid that. If you think you're going to buy souvenirs at the national park, I think we should avoid that. And the other problem is when you travel outside the area, should you be exposed, you might be quarantined in place. And so if it's a national park you want to stay in, that's one thing. On the other hand, if it's someplace where, you don't want to stay, I'm not sure I would do that. So how long does the virus stay on surfaces? This is an area of a lot of dispute. So, they, on all of these, when a new virus comes out, they do these tests where they take the virus and they blow it on surfaces and check to see how long it lasts. This one is probably a reasonably wimpy virus, so it doesn't stick around for a very long time. But it probably stays for a little bit, and that's why, when I was on radio today and I talked into the spit screen on the mic, they cleaned that spit screen before somebody else used it because the viruses probably could stay alive there for a bit. Certainly, doorknobs and frequently touched surfaces could stay for a while, and that's why we're recommending cleaning those. Probably can stay on your hands for a while, and that's why we're recommending hand washing. But things like picking up a package at the store, picking up my can of tomato paste, realizing that a person put it there and could have had the disease, not a big worry. The really big worry are wet surfaces that stay wet. So should we disinfect items like milk jugs when we get home? Again, I think the risk on that is relatively low, Sue. But on the other hand, if you want to do it, you could certainly use a wipe and wipe down the bottle. So can families get together, such as kids going to grandparents or playing around? So about four meetings ago, somebody said, well, what about playing with other kids in the neighborhood? At the time, that was still acceptable by the Oregon suggestions. Today, the recommendation was not to do that. Now, should kids go to grandparents? Crystal asks. This is a really hard one. My mom is 91 and she wants me to come visit. I don't think I'm going to do it because the fear is that I could be brewing this thing and be an asymptomatic carrier and make her sick. So I have strongly advised my mom not to see the grandkids. For her, that's really hard. And not to see the great-grandkids, even harder. And so basically what's happening is my brother, who lives near my mom, is dropping things off on the porch and then she's picking them up. The story is, we're going to be through this. It's in a time, month 2 or 3, we'll be through this, and then the kids should go to the grandparents. I had somebody approach me the other day, and they talked about, we were talking, and, I talked to a lot of people about this, and she started sort of weeping, and it was like, geez, what's going on here? And this lady was concerned that she worked with the public, that she would get this. She was caring for her mom, that she would bring this home to her mom, and she would kill her mom. A very, very sad story. So similarly, the story with kids going to grandparents is those kids have been around, those kids could be carrying something, and if the kids made grandma sick because of a visit, I think we would regret that visit. So my suggestion is you get FaceTime. My mom is not really into that yet, but we talk on the telephone all the time, and we would do it. So the question is, can I repeat who has the kits? And if you could go ahead and get that for me. I don't remember. I'll get that. So what about the newer vague symptoms that have been reported? So I think this is fascinating. And this is the loss of smell and taste associated with it. It's called, the medical name for that is anosmia, which is not particularly common, but there's been a report out of England that a number of the people who had this illness had a loss of smell and taste. Now, it's very interesting. I've talked to a bunch of people who I think may have had it, and I didn't ask that question early on. However, most of them said, my nose is weird. And I should have followed up a little bit more. They said, my nose is weird. And maybe that means they can't smell. It's interesting. Runny nose is not particularly common with this, unlike the flu and a common cold. And so on these tomorrow, I'm going to ask everybody about their sense of smell. I'm actually going to bring a little vial of coffee with me and have them smell it. Coffee is one of those things that people with a sense of smell can easily tell. People without a sense of smell say it doesn't smell like anything. So we're gonna check that out tomorrow, and I'll let you know on the next well, it's got to be the Facebook Live after we get the results of these people, and we'll see if that's predictive. That would be interesting if it was. So what do you do if someone is coughing in a store? The answer is stay 6 feet away. And so you shouldn't be within 6 feet in the first distance, and you should certainly stay 6 feet away. Now, I was in the store yesterday, and there was somebody with a mask and gown, mask and gloves, who was coughing. And it's like, why are you here? It was at Lowe's. Why are you here? And so we should do that. So what should caregivers of those who are elderly or disabled? So if we're taking care of the elderly and disabled, we have to be extremely careful not to pass the disease. So if you have any signs of illness, you should stay home. And to decrease your risk of illness and bringing it there, I'd have you stay home too. I think you're a really valuable and high-risk person. So stay home and stay healthy. Oh, goodness gracious. So Betsy says, and I think this may be a Betsy I know. So what can folks who are homeless do to protect themselves given that they have no place or no home to wash their hands? This is really problematic. So we are very worried about our homeless population for several reasons. One is the homeless, because they don't have a home, tend to congregate. And the second is they don't have adequate hand washing facilities. We've been working with the people at the state and people in Multnomah County, especially about services for the homeless, but this is one we don't have. This should cause, so if there's anything good that comes out of this whole epidemic, we should think about the services that we have there. So we should think about stocking up on materials. We should think about emergency preparedness. And I hope we think about how we treat the homeless. So the question is, can hearing be affected? I've not read that. However, I'm only reading about 1,000 articles a day, and there are probably 10,000. So not. So, Margaret, if you could write on the comments where you heard this from, I'll look it up. So what is the professional and clinical opinion on fabric masks, and how should they be used? Jenny asks. So the story is that there was a time when everybody used fabric masks, so that if you look back at MASH, they didn't have these high-tech masks that we use now, and they use fabric masks, and they work okay. So the the thing that works the best is those space-age hoods that we wore. They filter about 99.7% of small particles. The N95 masks, which are in short supply, filter about 95%, thus the name. A regular surgical mask maybe about 70 to 90, and then the fabric mask maybe 60 to 80. And so they're probably not great for the caregiver, because by the time the particles get to the caregiver, they're relatively small and could penetrate. But for the person who's sick, they're actually very good, because the stuff that comes out of the mouth are relatively large droplets, and fabric masks work well. They certainly work better than nothing. And if you looked at the CDC guidance from last week, it suggests even healthcare workers would do that. I don't think we're there yet, but the recommendation is for patients, they're great. So for sick patients at the doctor or the hospital, or people who are sick who must go out, then I would go ahead and use those. Do we have low positive tests because those tested were the medical field? Diane asked this question. I don't think so, because at this last clinic, I'm trying to think of how many people, I think only 3 were in the medical field. The other 32 were not. And those were the highest risk patients, right? We said to the doctors, well, don't send the worried well, don't send the people who've been sick for 9 weeks because they're unlikely positive. Send those people who are most likely to be positive. Those are people who have fever and cough for 2 to 14 days and don't have another obvious reason for it. So I don't think that's the reason. I mean, I think the reason we don't have lots of results from last week is they're not done yet. Lacey asked, can we get hand washing stations for the homeless? I really hope so. It's not something I could do in the next 2 weeks, but really that would be what I want for Christmas this next year, is for the homeless to have hand washing stations, a place they can safely dispose of medical needles, and a place they can dispose of their trash. So if anybody wants to know what to get me for Christmas next year, it's that. And the last question is, how am I feeling? I'm feeling great, actually. I was telling somebody here that this has been a lot of hard work. It's been invigorating, and I hope I'm well. I'm not having alopecia areata here. I really did shave the beard. So again, this is Dr. Bob Dannenhofer. I think we're at the end of our questions, so let's keep going here. Again, this is Dr. Bob Dannenhofer. We're going to have a testing site tomorrow at the clinic, and I think we have our 45 patients lined up. Our hotline number, 541-464-6550, and Oregon Serographics at 672-6296. Again, stay well, stay healthy. I think that's what the governor said. Social distancing is really important, and stay healthy yourself. Thank you.